The discovery of the sleep-wake system has enabled us to decipher the mechanisms of depression, to explain the way antidepressants work, and to define a treatment that causes no adverse side effects. The increase in vigilance due to stress, which is responsible for depression, causes insomnia and anxiety. These are two characteristic symptoms of depression. The sleep-wake system is quantitatively normal in depressive subjects. It is, however, insufficient for lowering their vigilance levels below the sleep barrier. Stress keeps them awake, and the lack of sleep causes depression. Once the cause of their depression disappears, along with the stress, patients recover normal sleep. Depression should therefore be treated as primary insomnia, but only for the duration of the depression itself. The sleep-wake system, which regulates the body's functions, is composed of 3 hormones, which are secreted by the pineal gland during the night. Melatonin, or MLT, is the neuroprotective hormone. It protects the neurons from the destructive action of oxygenated free radicals. 6-methoxyharmolin, or 6-MH, has extremely high psychostimulant properties, comparable to those of LSD. It is the wake and cognition hormone and can be described as the daytime hormone. Valentonin, or VLT, is the true sleep hormone. It is the nighttime hormone. The secretion of the 3 sleep-wake system hormones by the pineal gland is controlled by the suprachiasmatic nucleus. At bedtime, it triggers the secretion of these 3 hormones by the pineal gland for a period of 8 hours. For a person who customarily goes to bed at 10 p.m., the suprachiasmatic nucleus triggers the secretion of the 3 hormones via the nervous system for a period of 8 hours. In our example, pineal secretion will end at 6 a.m. In any case, secretion of the 3 hormones by the pineal gland will last for 8 hours, whatever the season, the period of the year, or the length of the night. In the pineal gland, the biosynthesis of the 3 hormones from serotonin is undertaken in 3 successive acetylation stages through the action of a single enzyme, N-acetyltransferase, or NAT. Melatonin being an intermediate stage in this cascade of biochemical reactions, the measurement of its concentration in blood plasma can be used as a marker for the secretion of the 3 pineal hormones, and therefore indicates the status of the sleep-wake system. As their biosynthesis within the pineal gland gradually progresses, the 3 hormones are released into the bloodstream. They are distributed throughout the body and reach their activity sites. The following shows the progression in the plasmatic concentrations of the 3 hormones during a 24-hour period. 2 periods can be identified. A secretion period for the 3 hormones from 10 p.m. to 6 a.m., during which the body is in sleep mode, as the concentrations of Valentonin in the body are higher than those of 6-MH. A second period during which the secretion of the 3 pineal hormones decreases, between 6 a.m. until 10 p.m. From 6 a.m. at the end of the pineal secretion phase, melatonin and Valentonin are rapidly eliminated. At this point, the prevalence of 6-MH puts the body into wake mode, which lasts until 10 p.m. Once distributed throughout the tissues of the body, the 3 pineal hormones undertake their actions of cellular protection and the regulation of the body's psychological and physiological activities. During the rest period, the secreted melatonin eliminates the oxygenated free radicals present in all the tissues of the body. These free radicals are produced by breathing. 2 main examples of these free radicals are the superoxide anion O2- radical and the hydroxyl HO radical. These are oxygenated compounds with 1 single electron. They're extremely reactive and lead to the gradual destruction of the body's cells and the neurons in particular. Thanks to its powerful reductive properties via the carbon atom located in position 2, the melatonin traps these free radicals by transforming itself into 2-oxomelatonin, which is consequently eliminated in the blood. The distribution of melatonin in brain tissue from 10 p.m. traps the oxygenated free radicals that have accumulated during the activity period. Simultaneously, these free radicals are reduced, and the melatonin is oxidized into 2-oxo-melatonin, which is consequently eliminated in the blood. At 6 a.m., as pineal secretion ends, nerve tissues are purified via this process. Meanwhile, Valentonin and 6-methoxyharmolin reach their sites of action and in turn regulate the body's psychological and physiological activities. By selectively modulating the responses of a few receptors of the 7 main neurotransmitters, and by modulating the secretions of the 7 endocrine glands of the body. In this way, the pineal gland controls the functions of the endocrine glands. As with the theory of yin and yang, Valentonin and 6-methoxyharmolin have opposite effects. The regulation of vigilance, blood pressure and muscle tonus are the result of the opposite actions of Valentonin and 6-methoxyharmolin on the serotonergic 5-HT2C receptors, the noradrenergic alpha-2 receptors, and the dopaminergic D1 and D2 receptors. Between 10 p.m. and 6 a.m., Valentonin lowers vigilance levels through the allosteric activation of serotonergic 5-HT2C receptors, which maintains the sleep status of our sample subject. Valentonin lowers the blood pressure and heart rate through the activation of noradrenergic alpha-2 receptors. Valentonin triggers muscular relaxation through the activation of dopaminergic D1 and D2 receptors. Inversely, between 6 a.m. and 10 p.m., the 6-MH increases vigilance by the antagonism of the serotonergic 5-HT2C receptors, which produces the effect of maintaining the state of wakefulness. 6-MH increases the blood pressure and heart rate by the antagonism of the noradrenergic alpha-2 receptors. 6-MH provokes muscular contraction by the antagonism of dopaminergic D1 and D2 receptors. Neuron protection from oxygenated free radicals and body functioning during 24 hours depends on how much of the 3 hormones the pineal gland secretes. As we have just seen, melatonin is a quantitative marker of this secretion. In practice, to ascertain the level of pineal secretion, the concentration of melatonin in the subject's blood plasma should be measured from 1 a.m. During a 24-hour period, we measured the pineal secretions of melatonin in 12 younger and 12 older subjects. There were considerable variations in pineal secretion levels between the various individuals. We observed a factor of 13 between the extremes of pineal secretions among the older subjects. On average, pineal secretion of melatonin declines with age. However, the record for the highest level of melatonin was found in a 73-year-old subject with a maximum plasma concentration of melatonin of 124.7 picograms per milliliter. Spectacular differences in pineal secretions may therefore occur among humans. Using melatonin levels as markers, we can consider pineal secretions as normal between 20 and 200, with an average value of 50 in a healthy young adult. Pineal secretion is excessive in psychotic subjects, with a marker probably higher than 200. Sleep disorders appear when the marker falls below 10. Subjects with a low level of pineal secretion suffer from sleep disorders and are particularly at risk of neurodegenerative diseases such as Parkinson's and Alzheimer's. As they grow older, they become victims of these diseases once their melatonin levels drop to below 5 picograms per milliliter of plasma. In depressive subjects, vigilance levels are increased by stress. The quantity of Valentonin secreted during the night is insufficient to lower vigilance levels and to keep them below the sleep barrier. A repetitive pattern of sleepless nights exhausts the body and leads to depression. The principle for treating depression therefore consists of restoring sleep by stimulating the 5-HT2C serotonergic receptors in order to reduce vigilance levels. This is what current antidepressant medications do. Antidepressants can generally be classed in two types of medications: noradrenaline-specific reuptake inhibitors, or NSRIs, serotonin-specific reuptake inhibitors, or SSRIs. They create sleep in two different ways, either directly by using SSRIs such as Prozac, which inhibit the reuptake of serotonin by the synapses of the 5-HT2C serotonergic receptors, or indirectly with NSRIs such as anafranil, which inhibit the reuptake of noradrenaline by the synapses of the pineal gland's noradrenergic receptors. This stimulates the noradrenergic receptors of the pinealocytes. This results in an increase in the secretion of the three pineal hormones, and Valentonin in particular. Valentonin being the sleep hormone, it creates sleep by stimulating the 5-HT2C serotonergic receptors. These two types of antidepressants have major disadvantages. Firstly, the inhibition of serotonin and noradrenaline uptake is not specific. It occurs in all of the serotonergic and noradrenergic receptors in the body, which causes a large number of adverse side effects. Furthermore, this inhibition occurs 24 hours a day, while reuptake inhibition should only take place during the night. This results in the deregulation of body functions. To enable depressive people to sleep without disturbing the normal sleep-wake cycle, the two hormones should be introduced into the bloodstream in the same way in which this is done by the pineal gland. In this way, as with the treatment of insomnia, the Valentonin and 6-methoxyharmolin are administered jointly during the night. Administration methods are extremely critical. They must be able to reproduce as precisely as possible the physiological secretion curves of the two hormones. In practice, the only solution is transdermal administration in the form of a patch with two reservoirs containing Valentonin and 6-methoxyharmolin with a dose ratio of 4:1 in order to fulfill these conditions. The patch should be applied at night, at bedtime, and should be removed in the morning upon rising. This allows the sleep and wake cycle to be respected. This treatment consists of hormone replacement therapy using Valentonin and 6-methoxyharmolin. It is administered during the pineal secretion period and increases the amounts of the two hormones. The doses, absorbed over 8 hours, are 50 micrograms of 6-methoxyharmolin and 200 micrograms of Valentonin. This treatment guarantees the absence of adverse side effects.